All right, let's jump right in. For a long time, the way we've tackled IgA nephropathy, which is one of the most common kidney diseases in the world, has been slowly changing. But what's happening now in 2025? Well, it's a huge shift. The world's top experts at KDIGO just dropped a massive update to their guidelines, and trust me, this isn't just a minor edit. It's a completely new playbook. And this quote right here, pulled straight from the new guidelines, is exactly why. You see, the whole way we think about this disease has been flipped on its head. What everyone thought was kind of a slow burn condition is now understood to be, and this is their word, relentlessly progressive. That creates a whole new level of urgency, a realization that if we don't get the strategy right, the end game for most patients is going to be dialysis or a transplant. So, to face this new reality, the experts built a much more aggressive, much more proactive strategy. And in this explainer, we're going to break down the 3 core parts of this new playbook. First, how we find the disease. Second, the new, much higher goals for treating it. And finally, the brand new workflow and the specific tools we're going to need to win. Okay, so part 1 of the solution is all about getting a head start. The new guidelines are really pushing for a complete paradigm shift in how we diagnose IgA nephropathy, urging doctors to find it way earlier, before it gets a chance to do a lot of permanent damage. Now, here's something that is absolutely key to understand. When it comes to diagnosing this disease, there's no ambiguity. Unlike a lot of other conditions, there is only one gold standard test, a kidney biopsy. There's no simple blood test or urine test that can give you a definitive yes. And that makes the decision of when to actually do that biopsy so critical. And this, right here, is the game changer. The new guidelines are calling for a more liberal biopsy policy. They've lowered the threshold for even considering a biopsy down to just 0.5 grams per day of protein in the urine. By casting a much wider and earlier net, the idea is simple. Diagnose patients sooner, start treatment faster, and save as much kidney function as humanly possible. So you find the disease earlier. Now what? Well, that brings us to the second part of this new playbook, which is to set much stricter treatment goals. The bar for what we call success has just been raised a lot. This comparison just says it all, doesn't it? The old guideline from 2021 was aiming to get protein levels under 1 gram per day. The new 2025 guideline cuts that target in half, pushing for less than 0.5 grams. Now, this is not a small step. It's a huge leap. It's basically a declaration that the old targets just weren't cutting it. But wait, they don't even stop there. And get this. The guidelines now spell out an ideal target of less than 0.3 grams per day. The message is loud and clear. Good enough is no longer good enough. The new ambition is to get patients as close to normal as we possibly can, and that shows a whole new level of confidence in the therapies we have now. And this is why all of this matters so much. Chasing these lower numbers isn't just for a better lab report. The real objective, spelled out right there in the guidelines, is to slow down kidney function loss to a normal, age-related pace, and then keep it there for the rest of the patient's life. I mean, that is a truly profound, life-altering goal. So, we have a lower bar for diagnosis and a much higher bar for treatment. How in the world do you actually pull that off? Well, that's where we get to the real heart of these new guidelines. It's a completely new way of thinking about treatment, a new conceptual framework. In the document, they literally call this a major new concept, and it really is. Instead of just one line of attack, clinicians are now being told to think about treatment with a dual focus, basically fighting the disease on 2 separate but simultaneous fronts. So what does this 2-pronged attack actually look like? Well, think of it this way. The first prong goes right after the root cause, that faulty immune process that's making the bad IgA deposits. It's like shutting down the factory that's producing the problem. The second prong is all about damage control. It's about protecting the kidney you have left from things like high blood pressure and something called hyperfiltration, which is when the healthy parts of the kidney are overworking themselves to death. Which, of course, leads to the big question. If you're going to fight a war on 2 fronts, what weapons do you have in your arsenal? Well, the guidelines lay out a modern toolkit with specific therapies designed for each part of this new strategy. All right, let's get into the toolkit itself. The guidelines give us a really clear framework for picking the right therapies based on which prong of the attack they support. It gives clinicians a much clearer path forward. And this table lays it all out nice and simple. On the left for prong 1, you've got your disease-modifying treatments. things like Nefecon and systemic steroids that go right after the immune system problem. Then on the right, for prong 2, you have these powerful kidney protective medicines, like RAS blockers for blood pressure, SGLT2 inhibitors, which also help the heart, and the newer drug sparsentan. And what's really exciting are the specific strengths these tools bring to the fight. Nefecon gets a special mention because it's a targeted therapy that's actually proven to lower the harmful IgA that causes the disease. Systemic glucocorticoids are just powerful, broad anti-inflammatories. On the kidney protection side, SGLT2 inhibitors have proven benefits for both the kidneys and the heart. And sparsentan is noted for its powerful ability to stop protein leakage, even better than our standard therapies alone. Okay, so let's zoom out and bring this all together. When you step back and look at the whole picture, what's the big takeaway from this landmark update? It's really a fundamental shift toward one goal: preserving a lifetime of kidney health. The bottom line is, the whole game has changed. The new mandate couldn't be clearer. Find the disease earlier with a lower biopsy threshold. Aim higher with much, much stricter goals for protein in the urine. And fight smarter with a dual-focus attack that targets both the cause and the consequences. And really, we have to end where we started, with these words from the guideline itself. This right here is the new mission statement for anyone treating IgA nephropathy. It's not just about slowing the disease anymore. It's about restoring a normal trajectory of kidney health and maintaining it for life. That is an incredibly hopeful and ambitious goal. And so this leaves us with the big question, doesn't it? For a disease that we once saw as just relentlessly getting worse, we now have this proactive, aggressive, and multifaceted strategy. The question now is, will it be enough to finally change the lifelong trajectory for millions of patients around the world? The tools are here, the playbook has been written, and the new game has officially begun.